Now, we've walked you through the heartache patients have been dealt after losing affordable access to their doctors.
That's right. We've been discussing the difficulty patients are facing with private insurance. For Medicaid customers often living at or below the poverty line, things are even dicier. We're continuing our team coverage tonight. WCIA3's Renee Cooper joins us live from our Capitol newsroom. So, Renee, there are even fewer protections under the laws for these patients.
Well, McLeod, we've told you state law outlines the number of specialists that have to be available to patients within 30, 50, or 100 miles of them. It also promises affordable access to pregnant mothers whose doctors are kicked out of their insurance network. And this is key in a state where OB/GYN facilities continue to close, and expecting mothers have effectively been left out of the policy conversation until now.
It's over 50%. So most of our Illinois births are coming from Medicaid members.
Jessica Davenport Williams co-founded nonprofit Black Girls Break Bread. A big part of that mission is equal access to health care.
I honestly think that when it comes to women's health, sadly, right, or when it comes to a racial equity lens, that some things are just not considered.
The organization was founded in 2016, and since that year, the Illinois Department of Health reports the closure of 16 labor and delivery units across the state.
Well, the issue is the MCOs are not doing their due diligence in regards to pregnant women.
Deputy Majority Leader Mary Flowers is talking about managed care organizations. These companies agree to provide a Medicaid benefits plan in exchange for a paycheck from the state. The catch is hospitals can pick and choose which plans they'll contract with.
And so if you have a patient living in central Illinois that has Meridian Health Care, however, their closest provider may not accept that health plan, then they have to travel an additional distance. We are in a maternity, an infant health crisis. And to have this additional layer for the residents who are most vulnerable is harmful.
When it's a matter of life or death,
Mothers should not be worried about whether or not this is an in-network hospital.
Representative Flowers is sponsoring a bill that will require managed care organizations to pay for prenatal and perinatal health care, no matter if it's from a contracted provider or not.
They have more than enough money to pay for whatever services that this woman and child may need. And this mother has already been proven to be Medicaid eligible. So I'm not talking about people just walking in off the streets. So I'm talking about a woman being able to make decisions on her own without worried about, will this bill be paid, will it not be paid?
And that's House Bill 5013. It did pass the House, and it's been sitting in the Senate Executive Committee for about a week now. It has the backing of dozens of representatives from both sides of the aisle. Now, whether it'll make that trip to the governor's office for a signature remains to be seen. Live in Springfield, I'm Renee Cooper, WCIA3, your local news leader.
All right, Renee, thank you so much. And another bill that's making its way through the State House would require companies to print the agency that has regulatory authority over the plan on the back of their insurance card. That was on the docket for the Insurance Committee today, but it has since been tabled for tomorrow.
This is an update.